now give the floor to the distinguished representative of Guinea.
Thank you, Mr. President. Mr. President, first of all, I would like to express the profound gratitude of my delegation for the initiative of organizing this meeting, which emphasizes once again your personal commitment to keep the international community's attention to the multiple challenges resulting from the tragedy of Ebola in West Africa. I would also like to thank the Secretary General, the Special Representative Vanbury, and the Special Envoy, Dr. Navarro, for their leadership and for the remarkable work they are carrying out in this very complicated mission. I would also like to thank the countries which have provided facilities to UNMIR for the operations in the region. Mr. President, we welcome with interest the report which the Secretary General has submitted to us. The report contains relevant information which enabled us to understand better the objectives, the precise objectives, and the immediate and future objectives which the Secretary General has set for UNMIR in supporting national efforts. We share the principles which are set forth, namely national ownership, flexibility of the mission, the commitment to take into account the other aspects over and above the Ebola problem, and also the strengthening of infrastructure, health infrastructure. Similarly, we are encouraged by the adoption of the global response framework with clear targets for the next 30, 60, and 90 days. It is comforting to note that the international community as a whole, the bilateral and multilateral partners, humanitarian organizations, NGOs, and the various donors, foundations, and private sector, motivated by this sense of solidarity, continue to make a considerable contribution in responding to the epidemic. We express to all of them our profound gratitude. Thanks to this important mobilization and better understanding of this epidemic, encouraging progress, is starting to be recorded in the field, with some slowdown of the scourge, depending on the location. With respect to the accelerated plan of action, many activities are being conducted in, for example, periodic coordinating meetings, the intensification of communications with the locations, logistics strengthening for follow-up activities in the various sub-districts affected, and surveillance through investigation of confirmed cases, treatment of those who are ill, and better management of the bodies of the victims so as to ensure safe interment, burial. However, we cannot rest on our laurels. We must make an additional effort because this disease is far from being conquered. So we have a long way to go, and we have a huge amount of work to be done. While the construction of treatment centers are being continued, there are still a number of challenges. For example, the greater need for qualified human resources and access to some very remote areas where people continue to resist the response efforts. The virus has already caused the death of more than 5,000 people and continues to seriously undermine the economic progress and the economic and social progress which was harshly obtained by the countries most affected. In Guinea, national cohesion is dangerously affected. The security and stability in political terms are being sorely tried. And this is why we are launching an urgent appeal for accelerated deployment of the United Nations missions, for emergency response UNMIR, and to the most affected areas in Guinea, Sierra Leone, and Liberia. Mr. President, my delegation would like to stress the need for greater coordination, not only among United Nations agencies on the operational direction of UNMIR, but also among the UN system and its other partners, which are acting on the ground, including regional organizations and sub-regional organizations, as well as the many NGOs. I would like to take this opportunity to reiterate our gratitude to all of the partners who are building treatment centers and providing equipment, medicines, and other materials. But we must remember that the effective response also requires specialized personnel, both foreign personnel and local personnel. So my delegation wishes to reiterate its gratitude to all the countries and organizations which are already working on the ground and invite all those who have promised the deployment of medical teams to respond very quickly with specialized personnel. The training of local treatment personnel is also important because this will help to make a significant contributions to strengthening the national capacity, who will remain after the epidemic. The recent experience shows that the social mobilization and aggressive communication at the community level are of crucial importance and will make it possible to achieve progress, significant progress, in breaking the chain of contamination and the follow-up with contacts. The behavior of peoples in certain regions would resist, but this is starting to change. So these efforts in the mobilizations must be continued and stepped up. For example, through the strengthening of rapid alert systems, prevention and the management of conflicts at the community level, and also support for the traditional communicators and religious leaders, as well as community radio. Mr. President, the main goal for the international community is directed, quite rightly, towards eradicating the virus, Ebola, the Ebola virus. And in this respect, the mandate of UNMIR is quite clear and seeks to integrate the capacities and competences of the whole United Nations system to provide a rapid, effective, and coherent response to Ebola. This, Mr. President, should not make us lose sight of the need, which is just as urgent, to mitigate the other adverse effects of the epidemic. As the Secretary General said so well, the epidemic, the Ebola virus has become a complex urgency with social, political, economic, humanitarian, and security consequences. Over and above the health aspect, these impacts have an adverse impact on the growth of our states and the well-being of our people. And in particular, the adverse consequences for health services, food security, education. This disproportionately affects the most vulnerable segments of our population, women, children, and the elderly. Specifically, Mr. President, the epidemic has already affected the offer and the quality of the provision of health provision of health services in Guinea, together with the equipment, the production, agricultural production, transport, which is whether air or by sea, for example, and a considerable increase in the cost of freight, maritime freight. Tourism is virtually halted. The budget deficit continues to grow. The balance of payments is largely in deficit. Urban employment is virtually destroyed. And this sad picture is also compounded by the challenge with respect to education and security. Mr. President, the United Nations system should here and now seek to evaluate the magnitude of the challenges which are very evident and to anticipate them so as to provide appropriate assistance to the most affected countries so that they can overcome the economic, political, security, and social difficulties. The program assistance to these countries should be revised to take fully into account the upheaval that the epidemic has already caused and the long-term fallout from these. In our opinion, any assistance concerning after Ebola time should, as a matter of priority, strengthen the health facilities in our countries to prevent any other epidemic of this magnitude. The contributions at the present time largely below what is needed to finance effectively the response. It would be useful, therefore, for the General Assembly to add its voice to those of the Secretary and his special envoy to encourage donors, which have not yet done so, and those who have made pledges to contribute to the special fund to finance the response. I would like to conclude, Mr. President, by seconding the appeal of the Secretary General to member states not to impose restrictions with respect to travel or visas, and not to close borders, but rather to deploy human resources which are specialized, essential personnel, which will help to contain the epidemic. Also, the approach whereby the resources are diverted, not only based on science, but also this has shown its effectiveness. We hope that this message will be heeded and that the scientific research will soon succeed in vanquishing this virus in the near future. Thank you very much.
I thank the distinguished representative of Guinea for his statement.